The COVID-19 pandemic has had an impact on the world, especially in terms of health. Like most countries, Fiji's health system still remains vulnerable. Existing health challenges would result in complex cases due to comorbidities. With Australian support, Fiji sources medical and personal protective equipment, redeployed experts into COVID-19 response task force, and improved coordination, planning, and resource management. So, how can we develop the resources that already exist in Fiji? To answer these questions, we overview a program that answers the needs of development and empowerment in Fiji. We present you the DOS Health Program, development of laboratories, optimization the role of health cadre, strengthening healthcare capacity. These programs cover how we can strengthen the basic healthcare system through policies, evaluation, and regular monitoring. Evaluation and monitoring can be determined by the maximization of healthcare efforts based on priorities. In this case, the priority can be in remote areas with vulnerable communities. It could also be a kind of maximization and equitable distribution of health services from the center of Fiji to all areas in Fiji.
So, the first point that we would like to carry out is strengthening healthcare capacity. Through this program, we propose to evaluate healthcare system based on current healthcare facilities conditions throughout Eastern Division of Fiji as our main concern due to inadequate of healthcare quality. This program will be conducted through a sequential cycle adopted from local health plans from Euronet that divided into several phases, such as the analysis of health situation. The second one is deciding priorities, objectives, and strategies of this program. The third one is conducting implementation of this program based on necessity, and the last phase is undergoing monitoring and evaluation of the program. On the implementation of this program, we also adopt elements of healthcare quality from OECD in order to choose three main elements that become the major key point to solve this problem, such as safety, effectiveness, and people-centeredness elements. These elements then become our main indicators to categorize the healthcare quality throughout Eastern Division of Fiji with the 5 levels with its own indicator as shown here. So, levels that become our main concern are poor and moderate groups. On the other hand, very poor group will be planned separately in order to conduct further advocacy to Fiji's government, while good and adequate groups will be followed up later. For the poor group, we will be focused on improving healthcare quality indicators that still not fulfilled here, such as the effectiveness, safety, and people-centeredness. We will also focus on responding to the demand of healthcare providers throughout Eastern Division of Fiji and communicable disease prevention as the main concern of this area. For the moderate group, we will be focused on healthcare quality system improvement by developing testing laboratories and optimizing healthcare drilling throughout this area. So, our expected result of this point is to enhance the quality of healthcare and provide effective, safe, and people-centered services for the community by undergoing these actions, such as the first one is expand the scope of basic healthcare services to be more accessible to vulnerable populations. Second is decrease the burden of disease for the better degree of health. And the last is improve the quantity and quality of healthcare providers to be equally distributed throughout Eastern Division of Fiji.
Our second program is development of laboratories, which aims to improve the health surveillance system, especially regarding infectious disease. Laboratory diagnosis is an essential element of communicable disease surveillance, both for routine confirmation of infections and for the rapid identification of the cause of outbreaks and epidemics. Surveillance is the ongoing systematic collection, analysis, and interpretation of health data. It's very important for pandemic preparedness. Through this program, we will build approximately 15 laboratories evenly all over the country, especially in Eastern Division, where most of the vulnerable populations live. The sub-programs of development of laboratories include: first one is forming and updating laboratory guidelines, especially guideline in emergency situation, to make sure the guideline is relevant and make sure the laboratory practice is in high quality. Second one is recruiting and training the laborants to ensure the quality of human resources behind the laboratory testing. The next sub-program is building the lab construction and preparing the lab equipment and supplies, continued by a laboratory operation for the first 3 months, continued with evaluation of the operation, including SWOT evaluation and the lesson learned, etc. The operation will be a continuous implementation accompanied by evaluation once a month. We propose to build laboratories based on these indicators. From this program, we expect to achieve more efficient specimen collection and accurate laboratory testing, and to provide punctual case detection to avoid delayed response.
Here is the optimization the role of health cadre. Health cadre is a selected group of people specially trained and educated about basic healthcare and assistance to help the healthcare workers. They are the representatives of the community to connect the healthcare system with the society. Health cadres have several main roles, such as educating the fellow community members about the knowledge they have gained, helping the healthcare workers to reach more patients, and playing an active role in emergency situations. To become a health cadre, someone should be between 18 and 35 years old and willing to receive basic training every week for the first 3 months and follow-up training every 2 weeks for the rest of the program. Health cadres would actively communicate and cooperate with the local health centers. Thus, in the beginning of this program, only health centers that got new laboratories would need to make a group of health cadres consisting of people from the villages and the cities. The detail as follows. Selected people would be trained and educated about basic health, hygiene, sanitation and wash, common contagious diseases such as flu, diarrhea, and COVID-19, first health aid, and disaster preparedness and mitigation. Why health cadre? Because we expected the local community to be more familiar with the terrain and the local environment, so it will be easier for us to reach the vulnerable population. With this program, we expect the empowerment of the community to actively participate and contribute to the appropriate healthcare systems, increase people's knowledge regarding healthy behavior, hygiene and sanitation, raising people's awareness to follow the instructions from the official local health agency during emergency situations, and the health cadres can become the frontliner of the Fiji community to assist the healthcare workers in a pandemic situation, such as helping with the contact tracing and logistic distribution.
In order to get a clearer picture of the program steps that will be implemented, let's review the work timeline. First, we will collect the data to assess the quality of health services in Eastern Division, Fiji for 3 months from June to August 2022. After that, we will analyze and evaluate the quality of priority for the next 3 months. And the third, we do the objective and strategy planning in December 2022. After that, the program implementation starts from January 2023 to June 2024. And for the detail, we can see it on here. We cannot design something without taking into account the cost that must be incurred. As for this program, we estimate $5,600 for basic health equipment set and $3,200 for hygiene maintenance, $13,414 for healthcare providers training, and for the development of the new laboratories, we estimate the total amount for about $112,760. Lastly, we estimate $65,000 for optimization the role of health cadre program. To sum up, we estimate the total cost of this program is $200,000. To improve pandemic preparedness for Fiji health system, we certainly need a lot of helping hands from various elements of society. Not only the government, but the participation of the Fijian people themselves should not be forgotten. Let's together help Fiji to become a healthier, because as the cliche quote is said, health is the greatest wealth.